Hi.
Hi.
Please introduce yourself and let us know who you are, where you're from, and how we can find you online.
Okay, so my name is Trotter, and I do interesting stuff with healthcare data and healthcare software, usually open source. You can find me online. I blog for O'Reilly, and I'm also at fredtrotter.com. You can go to Amazon to buy my book. Just search for Meaningful Use. It's right there at the top. Shameless self-promotion is a key skill. And so I also do a lot of work with the NPI dataset, which is the National Provider Index Identifier. National Provider Identifier?
Identifier.
Yes, identifier. You say NPI so many times that it's just NPI.
Right, it doesn't matter.
Yeah, it's just NPI. So I run a website called docnpi.com, which is the most powerful search engine for NPI data. And there you can see relationships in the current data download. So for instance, if you want to see all of the other doctors who your doctor shares an address with, I have normalized the download, which comes as a flat file, so that I can see repeated addresses and repeated phone numbers, and I can see relationships in that data that other people can't see. Is it okay to look in the eyes? Because I know that's something. Okay, good. So, anyways, so when you go to DocNPI, this is just me massaging government data. You can do all kinds of things that you can't do on the standard NPI search engine. So you can search by provider specialty. So if you want to find a cardiologist who lives near you, it's actually pretty difficult to do that. You can't search by cardiology on the standard NPI search, even though that's in the data. So I let you search by anything that I can in the data. You can actually search by identifier too. So for instance, if you are a billing specialist and you're trying to find identifiers, you can just search and find anybody who's got 46789 as their, Medicare, Medicaid ID number in Florida or something. So anything that's in the NPI data, I let you search on. And I'm doing a bunch of FOIA requests and other efforts to get more NPI keyed data. There's at least one database called PECOS database that's keyed against NPI. There's others that are keyed, and I'm trying to make it so when you go to a particular NPI in my search engine, you can get to all of the data that is keyed by NPI that the federal government releases. So if there's hospital quality data that's keyed by NPI, I let you see that all at the same time. So that's the kind of stuff I'm working on.
Great. And who are your users? And is this a business?
I wonder if there are users. I think so, because the logs say that people are using it. And I get complaints on a constant basis from providers who have put their personal phone numbers or their personal addresses into the NPI database, and then they find that information on my site, of course, because I'm just copying the public data, and then they complain to me that I'm violating their privacy rights, which of course I'm not, and it's kind of an understanding. And so basically I tell them, go fix it over in NPS, and then I'll automatically update it and you'll be fine. So what's interesting is that I actually have access. This is kind of an open question for me. I do have access to the history of the download files for the NPI. So that's a 300 megabytes. So I have all this data, which of course has privacy issues with it because people correct it and they accidentally put their phone number in and everything else. But I could theoretically do something where I let you search not only the current version but into the history. And I wonder how to do that in a way that respects provider privacy, because obviously if they made a mistake and they didn't know, a lot of the providers who contact me are in a situation where their hospital put their information in for them and put their wrong phone number in and put their home address in, so they didn't make the mistake. So in that case, it's extraordinarily difficult, and so I'm not sure exactly what to do with that historical data. So, but it's an interesting use case, and I think for people who are trying to sort out what happened over time with a particular provider and see patterns like that, it's extraordinarily interesting data to see, well, there's all kinds of stuff you can see if you can see the historical data, and I wonder how much of that I should expose for privacy reasons for providers.
Has it become easier over time to access these data and updated data sets from the government?
So for this particular one, this data release was released before this big push for the health data release. So the healthdata.com or healthcaredata.gov or whatever it is, they're kind of promoting at this conference. The NPI has been downloadable for years before that, because it was mandated by HIPAA that it be public and downloadable and everything else. And so what's interesting is that there's actually a payer database that is also mandated to be public by HIPAA, which I can't find the download for. And I think you can actually get it if you know the right person in the government by doing a FOIA request or something else, but it would be nice if that were also available, because I could do the same kind of work in there. But anyways, the provider database is very interesting, and it's on healthcaredata.gov or healthdata.gov or whatever it is. It's there. But it's just a link to the same old monthly download that they've been doing for years. It's very easy to get the data. The problem is it's like 500 megabytes. It's 3.5 million rows approximately in it. There was a time when I was working with it so much that I could tell you the actual number down to the last digit, but thankfully I don't know that anymore. Because the scripts go running, and so, you know, obviously more people added, so it changes every month.
So it's available, but people who want to use the information,
yeah, and all the work that I'm doing, I mean, it sounds innovative, and the irony is what's innovative about it is not what I'm doing, because every healthcare provider, every payer does exactly what I've done. There's some programmer whose job it is to do what I did internally at that payer. So Aetna's done this, and Blue Cross Blue Shield has done this. They've all done this. So everybody who's on the inside of the kind of payer network sees the data the way I see it. But what I do is I expose that to patients and the public and reporters and, you know, billers, people who don't get to see all of those relationships that are in the data. So that's kind of what I'm trying to do is show the relationship between providers in the United States.
Great. Thank you very much.
You're welcome.